long before what we call AIDS with the capital AIDS. It was principally in people who were malnourished or premature babies, for example. There was good examples of this after World War II when the Allies went in and they looked in Germany and they saw the consequences of malnutrition.
Sure.
And AIDS popped up among these children especially, and even some adults, just malnutrition. In fact, malnutrition is the world's leading cause of acquired immune deficiency.
Well, that shouldn't be a surprise. I mean, it makes sense.
No surprise.
If you don't have enough of the nutrients you need to take in, your immune system is going to go south. It can't do the job it's supposed to. So you've got an acquired immune deficiency syndrome.
That's
and
right.
the problem is the word AIDS is more charged.
Right.
People don't think what AIDS stands for.
Right.
They just think it's this horrible disease that happens because of HIV and in gay men and drug users.
And sexually transmitted.
Right.
In the industrialized world, the principal causes of acquired immune deficiency is drug treatment, chemotherapy for cancer, for example, and also drug therapy like cyclosporin A for organ transplant patients.
Okay.
The cyclosporin A is
so we're trying to interfere with immune competence.
With the organ transplant drugs.
Yes.
You intentionally depress the immune system so that the patient doesn't lose the liver or the kidney or whatever.
Exactly.
But you have to titrate it, you know, or they'll get sick with AIDS disease.
Or you might kill them.
You kill them. You can kill them with it. So those were the principal sources of AIDS, acquired immune deficiency syndrome, around the world.
Okay.
Recreational drugs. Peter Duesberg and I have documented over the past 100 years that chronic use of heroin and cocaine and amphetamines and the poppers, the nitrite inhalants the gay men use almost exclusively, can cause AIDS-defining diseases. And that explains principally why the gay men, for example, were so disproportionately among the gay statistics.
So all you're saying is that these people with these kinds of lifestyles have immune deficiency problems.
That's right.
And it's acquired.
Right.
Okay, so it's AIDS.
Right. And the CDC understood this as early as 1982. They actually had it figured out. It wasn't rocket science. All this stuff is known. But then after that press conference, Robert Gallo was the one, you know, who said that his retrovirus, and then he was the one that said it probably came from Africa and it's probably sexually transmitted. He's a retrovirologist. He should know better that...
that's by decree again.
That by decree that retroviruses are not sexually transmitted. They're not. And even if they were, they're totally harmless.
So he had a lot to gain from this.
He did. He
made a lot of
became a
money.
millionaire.
Yeah,
on
at
this
least a
HIV
millionaire.
test, at least, yeah.
So the HIV test, and then he takes a stand against anybody who has an argument against that by decree again.
But he was quietly pushed out of the NIH in the early 90s because of some very controversial work. In fact, he was convicted of scientific misconduct for basically stealing the retrovirus that we call HIV from Luc Montagnier.
Frenchman.
Right. And then I believe it was the Reagan administration that came in and said, no, we can't have our big discoverer of the cause of AIDS being convicted, so they changed the rules, you know, and then throughout the conviction, but quietly they forced him out. So you hardly ever hear anything from Robert Gallo anymore.
That's right.
You know.
Now, we talk about treating acquired immune deficiency syndrome, AIDS, with drugs that are very toxic.
Right. The chemotherapy for cancer, basically.
So it's doing more to suppress the immune system.
It does, and they're extremely toxic drugs. There's not an HIV drug on the market that does not come with a black box warning label. That's the most serious warning that the FDA puts in a label before they pull the drug off the market.
Could it be that somehow, for reasons we don't understand, that the drugs that are used, like AZT and others, to treat people with AIDS, have a beneficial effect on them, on their disease in some way? Is that possible?
It's always possible for that to happen. Is it probable? I mean,
Can we explain it would be a better way to say it.
Right, can we explain it? You probably can, but what is really clear in the literature is that these drugs in mass on the large numbers of people, you know, 95% of the people for sure do worse on these drugs than people who don't take them.
How do you know that?
It's in the mainstream literature itself.
So you can quote the articles that say that. Why don't the doctors look at that? Or is that your question?
MDs, basically physicians, practitioners, do not read the scientific literature.
So they're basically following CDC recommendations.
Yeah, that's true, but they also, you know how they learn about drugs, the pharmaceuticals? They learn about the drugs from
the drug company.
the drug salesman.
That's right.
That sends it to
that's
them.
true.
You know, they don't read the primary literature on this stuff.
Well, don't include me in they.
No, absolutely not. That's why we're here.
That's right.
It's because you're not a they.
All right, so these drugs then that are using to treat immune deficiency are actually causing it. Is that what you're saying?
Yeah, they weren't actually designed to treat immune deficiency. They were designed to kill HIV.
Okay, that's what I meant by that.
Right.
Okay.
Assuming that HIV is destroying the immune system. However, as you mentioned, AZT, DDI, 3TC, D4T, and all these other nucleoside analogs were developed in the 1960s as chemotherapy for cancer. No physician would prescribe cancer chemotherapy for the lifetime of the patient. They would be taken up on charges for malpractice because the chemo will kill the patient if they stay on it for the life.
Right.
But yet, if you're HIV positive, if you happen to have antibodies that react on the Abbott Laboratories test or whatever you call HIV positive, the standard of care is now to give you these drugs for life.
Wow.
And these drugs can kill you. In fact, they do kill you. And since, I think, the late 1990s, the leading cause of death among HIV-positive Americans is liver failure.
Right. Caused by the drug.
Caused by these drugs. And now, since, again, about the mid-1990s, there's a new problem. The AIDS establishment is sweeping this under the rug, and they're giving it a new name. They're calling it IRS, for Immune Reconstitution Syndrome.
That's as bad as IRS, Internal Revenue Service.
Yeah, that's easy to remember. And these drugs are causing exactly the same AIDS-defining diseases that the CDC came up with in their clinical definition of AIDS. What makes them called IRS, or Immune Reconstitution Syndrome, and not AIDS, is because these diseases now only pop up after people start taking the antiretroviral drugs, on weeks to months.
Wow.
They're exactly the same diseases as AIDS, so instead of calling them drug-induced AIDS, they're called immune reconstitution syndrome.
Well, that's sweet. That just avoids.
And it's a huge literature on this now, and whole conferences are devoted to this problem.
Now, this is interesting because maybe most of the doctors don't read the medical literature and do it seriously, and they do kind of what everybody else in the profession recommends because those are the standards of practice in the community. But the pharmaceutical companies know this.
Yes, they do.
Because they make the information up.
So does the
NIH. The CDC must know it.
They do.
Okay, and yet they're perpetuating this myth.
Right.
Anyway.
Well, okay. You know why it has to continue?
I think I do, but you say it.
But I'll say it. All a person has to do is imagine, just imagine that what we are talking about here is true. Yeah. That AIDS is not contagious, it's not sexually transmitted, it's not caused by HIV. The anti-HIV drugs are killing people and causing AIDS-defining diseases.
Wow.
And on top of that, there's no such thing as an AIDS epidemic in Africa, and we can talk about that.
That's another subject.
That's another subject entirely. Now, if all of that is true, we spent $250 billion on this bogus blunder, this biggest scientific medical mistake of all time.
The germ of lies, huh?
Germ of lies.
The title of your book.
Right. Then what is the likelihood that the directors of the National Cancer Institute, the National Institute of Allergy and Infectious Diseases, Secretary of Health and Human Services, or any president of the United States is going to say, "Oops, folks, sorry, we made a mistake"?
Yeah, right.
What is the likelihood of that happening now?
Well, I guess it's not too good because it hasn't.
The CDC actually, when Peter Duesberg had his article back in 1987, in Cancer Research, where he critiqued the whole thing about retroviruses in general, HIV in particular, and how they could not cause any disease. The CDC, Peter was able to lay his hands on an internal memo that was going around that said if this got out and the public knew about it, nobody would ever believe us again. Right. That's it. That's basically it. It's not even about money anymore, really. It's about face saving. It's about the whole infrastructure or edifice of the healthcare system in the United States, possibly the whole institutional form of government would be seriously undermined by the fact that this huge $250 billion mistake was allowed to happen, and it's continuing to happen, and the people in the government know it. They absolutely know it.
There's also got to be pressure, too, because from the point of view of the pharmaceutical industry, we know the hold that they have on the FDA, on the Congress, because they've got a lot of money, and they have more lobbyists than any companies in the world. And so they can buy their way out of a lot of this, I think.
They will come out of it clean. You know why? They're just going to the next disease, the next drug. It's the federal government is really keeping this alive. It's not the drug, because
Okay.
they have their institutions that they have to consider.
We've only got a couple of minutes left, and I want two subjects I still want to cover. One is the HIV kids.
Yeah.
Okay, these are
right.
kids that are HIV positive.
Right.
They're healthy.
Yeah.
If the parent won't follow the advice of the doctor and give them the AZT drug, Child Protective Services comes in and says, we're going to take the kid away from you.
Yeah.
What do you think of that?
It's horrible. I've been involved in a number of these cases on the side of the parents trying to keep their kids from being taken away and being poisoned on these drugs. And I've known a number of cases over since the 90s that I've been personally involved in on a legal basis. It's horrible. It's absolutely horrible. These children and parents have absolutely no civil rights when it comes to health care. And that is an abomination. And I hope that these court cases, we need to put these things on trial. We need to take a lawsuit, or make lawsuits against Wellcome, GlaxoSmithKline, and these other places that are killing people with these drugs. Right. To public, basically, not so much that I want to hurt them, which I don't care about that, though, one way or the other, but it's got to be publicized somehow, and the best place to do it is in the courtroom.
And that's where the data you can bring from the studies that have been done that are in the scientific literature that show all the things that you're talking
Absolutely.
about. Because they're a matter of public record.
Absolutely. It's
Now,
easy to come by if you really want it.
Okay, so now if somebody is HIV positive and you want to do, if you're going to do anything for somebody that's like that, you would probably propose doing nothing. But
Yeah.
if somebody comes to you and they have even acquired immune deficiency syndrome, they have AIDS, how would you propose treating them? You use lifestyle things? You support them? I mean,
I tell you what,
we only got about a minute or two left.
Sorry,
So I don't know how you're going to do that.
I'm not a physician, but I know one thing.
But you know a lot about this.
I know a lot about this. I would treat symptoms, you know. I mean, if it's malnutrition, feed people. That's what we did in South Africa. It works like magic. It's
Right.
amazing. They get better, really, right before your eyes almost. You don't treat them with toxic drugs. You don't. I would tell people, I'll even make it even more blunt. We need to outlaw the HIV test. We need to outlaw these tests. They're horrible. They kill people. The tests kill people because then they go on and they take the drugs and the drugs kill the people. Nobody, I would say nobody should take an HIV test. They should refuse every opportunity or any pressure to take an HIV test. Don't do it.
Can anybody force you to take an HIV test?
You can if you're in jail, for examel, and they've tried to make, in some states they force, it's on a state-by-state basis. And anybody who's ever had an HIV test, totally forget about it. Erase it out of your mind if possible. Now, if you can't, then the HIV test is so unstable that the result depends on what day you take it on, where you go, and who looks at it. It's totally arbitrary.
So it might be negative one day and positive another.
Exactly. So if you're positive and you really, really want a negative, just keep taking test after test until you get the negative, and then use that result.
Okay. So maybe that's the thing to do for parents who have HIV positive kids who are doing well. And what you're saying, basically, if I understand it right, is look at the disease, don't look at the label that's put on it.
Exactly.
And then do what you can to support that illness, doing the safest things you can that are possible.
Safe.
And at lifestyle first.
Yes.
Get the healthy diet, do exercise, do the kinds of things that you can do to keep people to get enough rest, reduce the stress in their life, keep their weight down, make sure they have a meaningful purpose in their life. We do all those things that doesn't work, then we move on to things that are a little bit more aggressive, but certainly not thinking about using anti-cancer drugs for a disease that's been fabricated and probably doesn't even exist. That's the position you would take.
Absolutely. I mean, I couldn't have said it better.
It's such a privilege to have you on this show, David. Thank you so much for
I've
being
enjoyed
here
it
today. There are not too many people that have the courage that you do to have stuck out for so many years in an area where the public is not really receptive to hearing what you're saying, and physicians get angry with you. I've tried to put together a couple of AIDS conferences, which you know, that include you and Peter Duesberg, and have invited physicians to be there, and have had no luck at getting one physician to face you or Peter. That tells me something. It means that some of what you're saying has to be true, and that the doctors know that, and they don't want to be involved in a position that's going to get them in trouble with their medical board or their colleagues.
You pay a serious price to speak out on this. It's cost me, it's cost Peter. You know this well. It could cost anybody.
It's a pleasure to have you here today.
Thank you.
Thank you, David.
I've enjoyed it.